Hey everyone, this is Morgan. This is my interview for the 10 questions. I did my interview with one of my patients that I had in clinical. So her biosensor technology was an EEG hookup for about a week. So my first question was, what is the nature of your condition? So she has been having seizures again for a while. Hers had come in spurts, different periods. She had them when she was younger, and there was a long pause. Probably when she was around 13, 14 is when she said she was having her first seizures, and then she really hasn't had them recently until the last couple of years, and my patient was almost 60 years old. So she's just trying to figure out why she's having seizures, what's causing her seizures. My second question is, how long do you expect to use your biosensor? So at Mercy, when EEG patients come in, they typically stay for 5 to 7 days, and that's depending on the doctors, and it's usually a Monday through Friday or Monday through Sunday. So she was explained all of that at the beginning. And in EEG, sorry, for those of you if you may not know, it's just little electrodes that are glued to your head and just monitors your brain activity. So my third question is, what were your concerns, if any, before using it? So she was just kind of concerned about, her big thing was her hair, if it was going to affect her hair or if it was going to hurt or anything, and she was explained, it's not going to hurt, that it's very easy to come off. You just have to wash your hair a couple times. So she really didn't have any major concerns. My fourth question, what do you perceive as negative or positive effects of the use of the biosensor on the quality of their life, health, and their daily lifestyle? The positives of it was that hopefully she's going to find out the cause of her seizures, and negatives, she would have to stay pretty in the room the entire time. The EEG line is not very long. It has enough cord to let them go to the bathroom, but they necessarily can't walk around in the hallway or go outside or anything. So that's kind of a negative of being in the same room for 5 to 7 days straight. Positives, hopefully finding out the cause of her seizures. My fifth question, what made you decide to move forward with having this, using the biosensor involved in her care? Well, she really needed to figure out why she was having seizures. If you've ever seen anyone have a seizure, it's not fun. It can be very scary and sometimes dangerous. My sixth question is, were you scared or nervous? And she was kind of scared in a way to find out why she was having them, but then that would be relieving at the end. And she was just nervous being away from her husband for 5 to 7 days and not being in her home. So the seventh question, how did you feel about having to voluntarily stay at the hospital for 5 to 7 days? Well, like I said, she didn't necessarily like being away from home. Her husband did come to visit, but she was very motivated and had a very positive attitude about finding out why she was having her seizures. My eighth question, how well did they explain the EEG process to you? And she said that it was explained to her very well, that all of her questions were answered. She just asked how they were going to be placed on her head, and she had asked, if she was going to be able to go walk around or anything, and everyone was very informative for her. My ninth question, now that it is towards the end of your stay, do you feel it was worth it? I had my patient actually that Thursday and Friday. I had her 2 days in a row for clinical. So they actually had not really seen any jumps in the waves on her EEG readings. She did find out though that hers were from stress. So hers were non-electrical based seizures. Her were more based on stress triggers. When she was younger, she had been through a traumatic experience that I won't talk about just for her privacy. And now that the last couple of years have been very hard on her. My patient had breast cancer and had double mastectomies, so it was very stressful for her, and that was kind of a trigger for her seizures again this time. And she had moved far away. Her hometown was in Wisconsin, and she had to move from there again back here to Missouri, so that was another stressful situation for her. So hers were just very stress based. So the good thing is it wasn't any anatomical cause in her brain, just stress. So she felt that it was worth it, and my 10th question was, would you do this again or use another type of biosensor? And she totally would. She felt that she gained what she had come to the hospital for, and she said if any other health issues arose where she would need to figure out answers why, that she would totally do it, because she was relieved whenever the nurse practitioner had really sat with her, got to know her, and figured out, why she was having these. So that's my interview.